Well, let's dig into the record levels of COVID-19 cases and rising hospitalizations in Quebec. The province is reporting more than 15,000 new cases of COVID-19 and 15 more deaths. There are 1,396 COVID-19 hospitalizations. That number is up by 165 in the past 24 hours. 181 of those people are in the ICU. That's an increase of 19. Dr. Jesse Papenburg is here now to discuss the situation in that province. He's a pediatric infectious disease specialist and medical microbiologist at the Montreal Children's Hospital, and of course he's in Montreal. Hello, doctor. Thanks for joining us today.
It's my pleasure.
First, your reaction to today's numbers out of Quebec. 15,000, more than 15,000 new cases reported today. Is this where you expected Quebec to be at this point?
Well, first of all, I think 15,000 is a gross underestimate. The positivity rate is well over 25%. We're missing a lot of cases for sure. People are not going to get tested. People are using rapid test at home, and there's no way to declare those positive results to public health. So I think this is a substantial underestimate. More importantly, we're seeing the number of hospitalizations increasing, and on a day-to-day basis, it looks like those numbers are the incremental rate of increase is also on the upswing, which is potentially worrisome.
Now you've got the curfew in Quebec, deemed one of the strictest measures across the country. Do you think there was no other option, first off? And secondly, is there any proof that curfews actually do anything?
Right. To be quite honest, there are a few public health measures that have been put into place where there really aren't very great data to support their use, and curfews are one of them. I think that one of the potential benefits of the curfew is that it limits social interactions, and we know that that's what's required in order to limit transmission at the community level. And in particular, the curfew, I think it targets that age group, 18 to 40 years old, that do tend to socialize after 10 o'clock at night. And that's the age group that's driving community spread right now in Montreal and other parts of Quebec. So, there's potential for it to be effective from a strictly a social contact perspective. And I think the other thing about curfews is it does send a very strong message to everybody as a daily reminder that we're in a very serious situation right now. So, I don't have good science to back up its use as a way to decrease transmission, but there are arguments for it.
I think anybody in Quebec is also going to say that, as people are saying across the country, that everybody's tired of this, right? Like we're sick of this. A curfew is going to take a toll on people's mental health, and yet the province has a problem, right? It's got all these rising numbers. How do you think the province should balance the two? People's mental health, bringing in a strict curfew with stiff fines, versus dealing with Omicron and the transmissibility of it.
Right. These are tough decisions to make, no doubt. And I think that as a whole or collectively, the idea of a curfew is a little bit harder to swallow this time around for a couple of reasons. One, we do have a vaccine program that is limiting the hospitalizations that we're seeing. Where, with this number of infections, had we seen that in the first or second wave when there wasn't the previous vaccine program rolled out or booster doses being rolled out, the hospitalization rates would have been through the roof. So we already are able to better absorb this level of community transmission thanks to vaccination. And the other thing is, I think that this curfew is a little bit difficult to swallow for some people, a lot of people actually, is because the government was kind of late in coming around to the realization that we need to take this wave seriously. Before Christmas, very soft measures were put into place, and they were talking about, well, we'll do more perhaps after Christmas, when really I think that if we want to get ahead of the game, we need to start being a bit more aggressive before the Christmas break. So I think for these reasons, it's a little bit harder at the population's level to accept the curfew. Now, unfortunately, I don't know that we have that many other options at this point.
Meanwhile, as hospitalizations go up, what that means is stresses on hospitals and stresses on healthcare workers. And at the same time, because Omicron, healthcare workers themselves are getting sick, increasing the stresses in hospitals and among healthcare workers. What's your sense of what it's like on the ground for medical professionals in Quebec right now?
Well, it's very stressful, that's for sure. We have colleagues all around us who are either at home sick with an infection or have household members who are sick with infection and therefore they're being quarantined. People are being asked to cover all sorts of shifts. It's a period of great stress, no doubt. And just look at what happened in Quebec City, where they've had to institute really more serious measures in terms of delaying elective surgeries, closing down a lot of their procedures, and in terms of diagnostics and interventions, because they just don't have the personnel right now, or they have to reaffect that personnel to areas that are more urgently needed. So hopefully this is not something that's going to become widespread, but you're absolutely right. With the number of cases in the communities, like, it's just inevitable that healthcare workers are going to get sick. And that's why it's so important for that healthcare workers be prioritized for that booster dose and that they get it as soon as possible. To
parents in Quebec who are, freaking out about schools, and we're talking the middle of January now, January 17th, I think, at this point, is that realistic in your view, given what Omicron or how it's behaved so far?
Well, thankfully, in pediatrics, we are seeing an increase in the number of hospitalizations of children with COVID-19, but not necessarily for COVID-19. So some of these are fortuitous detections in kids that were being admitted for other reasons. So we're not yet seeing a pediatric wave of admissions the way that we're seeing that on the adult side. So that's one thing. Severe outcomes in kids remain relatively infrequent. So that's the first thing to remember. Now, what we do know for sure is that prolonged periods of school closures have really negative effects on children, whether they be adolescents or younger developing children, in terms of their mental health and their ability to succeed in school. And we know that school closures disproportionately affect children that are already having trouble in school and at risk of either dropping out or failing. So I think that if we are using these delayed closures as a way to get ready to have schools open as safely as possible by making sure that all school teachers and people that work in school get their booster dose. They are a priority group in Quebec, implementing rapid testing programs in schools to try and keep classrooms open when there is a case. If we're using this time to shore up the safety of our schools, I think that's great. Hopefully this won't go beyond January 17th.
Hopefully. I appreciate your time. Dr. Papenburg, thank you.
It's always a pleasure.
Dr. Jessie Papenburg in Montreal.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.